Hi, I'm Dr. John Baker. I'm a chiropractic doctor in Longview, Texas. And if you've been keeping up with my video channel, you might be aware that in the last couple of months I've focused more here lately on the disease of Alzheimer's. I've also put up a couple of blogs and a website, and I try to get into the different aspects of Alzheimer's, including personal security for Alzheimer's patients, some of the drugs that are out there, impact on caregivers, personal liberty, legal aspects of Alzheimer's. Today, though, I wanted to kind of focus on some of the statistics that show a little bit of the impact of Alzheimer's on both caregivers and the nation at large. Excuse me for having to drink some water. It's kind of hot today. One thing I came across in researching this topic is the following statement. There are no survivors of Alzheimer's. You either die with it or from it. And a lot of people think that Alzheimer's, or as they like to call it, old-timers disease, is more or less forgetfulness on steroids. It's actually a fatal disease. In fact, it's the sixth leading cause of death among Americans. And in folks that are over 65, it's the fifth leading cause of death. And I'm going to be referring to some of these pages. These notes I got are from alz.org, which is a website from the Alzheimer's Association. And I find they have some really good statistics on the disease. In 2010, 83,494, almost 84,000 Americans died of Alzheimer's disease. And one thing that's particularly striking is that in the years in the decade 2000 to 2010, all the diseases, the main diseases, breast cancer, heart disease, HIV, all decreased in the number of deaths. Only one increased, and that was Alzheimer's. So what you can see is this is HIV, this is stroke, this is heart disease, this is prostate cancer. I'm doing this backward. And this is breast cancer. Breast cancer, of course only dropped 2%. But this giant purple bar represents deaths from Alzheimer's, which rose 68%. Every 68 seconds, someone is diagnosed with Alzheimer's, and it's projected that by 2050, every 33 seconds, someone will be diagnosed with Alzheimer's. An interesting fact is the impact that Alzheimer's has on mortality. With 70-year-old folks that have Alzheimer's, 61% are expected to die before they're 80 years old. In 70-year-olds without Alzheimer's, only 30% are expected to die before they're 80 years old. It's the only leading cause among the 10 causes of death that we have no cure for, we have no real treatment for, and there's no way to slow it or prevent it. Dementia is the second largest contributor to death among older Americans, second only to heart disease. Now, the financial impact on both caregivers and the nation in general is huge, and if we don't do something about this disease, it's could bankrupt the United States. It's so tremendous. In 2012, 15.4 million Americans, so-called non-paid caregivers, provided 17.5 billion with a B, that's 17,500 million hours of unpaid care. The value of all that care was around $216.4 billion, which is 8 times the total income of McDonald's Corporation for the year 2011. That's 8 times the total income of McDonald's, total sales of McDonald's. Nearly 15% of caregivers are what's called long-distance caregivers, who live an hour away more from their loved ones, and out-of-pocket expenses for these long caregivers are double what it is for the folks that live closer. In 2013, the direct cost of caring for folks with Alzheimer's to American society was $203 billion. That's with a B. 203,000 million. Of that figure, 142 billion was paid for from Medicare and Medicaid. And around 30% of Alzheimer's patients have both Medicare and Medicaid. The statistics show that for someone with Alzheimer's, the expenditure by Medicare is 3 times what it is for someone without Alzheimer's, and for Medicaid, it's 19 times the average cost of seniors that are on Medicaid. So that's a tremendous figure. There's the 30% that I said that have both Medicare and Medicaid that are Alzheimer's is compared to 11% of seniors who have both that don't have Alzheimer's. Now, let me move on. I'm going to probably be slow on some of this, so don't worry, Alzheimer's hadn't kicked in yet. Another thing is this misconception that only old folks get Alzheimer's. Actually, currently there's about 200,000 people under the age of 65 who have Alzheimer's. In 2013, that's this year, an estimated 450,000 people in the United States will die with Alzheimer's. What that means is they will die after they have the diagnosis of Alzheimer's, which means they may die from Alzheimer's or with Alzheimer's. But again, back to that saying, there are no survivors of Alzheimer's. You either die with it or from it. In fact, 1 in 3 seniors dies from Alzheimer's or another dementia. And what they say is that right now, we were talking about there's $216.4 billion that unpaid caregivers are providing, that if they weren't doing this out of the goodness of their heart, that someone, probably the government, would have to pay. So you have to add that 216 billion to the 203 billion, so you're looking at about $500 billion total that is really the effective cost of Alzheimer's. And they're saying that the amount of cost of Alzheimer's by 2050, in other words in 37 years, is expected to rise to $1.2 trillion. That's an increase of 500%. So you can see when people say that Alzheimer's might bankrupt the United States, it's not a hyperbole, it's not an idle threat. Well, I wanted to go over a couple more things before just kind of getting into a rant, kind of free form. Bear with me a second. One thing that often is overlooked is the price that the unpaid caregivers actually pay in their own health. In fact, it's estimated that 1 out of 3 folks that cares for Alzheimer's is reporting depression, clinical depression, because it's depressing to see someone you love start spiraling downward. But it also, beside this kind of nebulous saying that, you get depressed, it also costs actual dollars to them in increased health care costs. I wanted to find that really quickly. Oh yeah, here it is. Sorry. Due to the physical and emotional toll of caring for folks with Alzheimer's, caregivers had 9.1, so it wasn't 91, it was $9.1 billion in additional health care costs of their own in 2012. So that's in just 1 year, 2012. Folks that are unpaid caregivers, family and friends of Alzheimer's patient, had an additional 9.1 billion healthcare costs that they wouldn't have if they weren't having to care for someone with Alzheimer's. So what we're seeing is that there are costs both for the person with Alzheimer's, also for the person who's a caregiver of Alzheimer's, and to the government, Medicare and Medicaid costs. And it's only going to increase by the year 2050. I think that the diagnosis now that somebody gets Alzheimer's every 68 seconds, by 2050 it's going to be every 33 seconds. Now, what is being done to cure the disease? Most of the focus on cure for Alzheimer's has been looked at as far as the beta amyloid deposits. There's been a few other folks that have gone different routes, but solely focusing on beta amyloid as being the cause of Alzheimer's seems to be a blind alley. It's not really leading to a cure, and I think it's not that simple. I think that the cause of Alzheimer's is multifactorial, including genetic predispositions, health choices such as whether you exercise, smoke, drink, etc., and also whether you're staying active both mentally and physically. And you'll see a lot of material in the topics about Alzheimer's that if you stay alert mentally and exercise physically, your chances of getting Alzheimer's probably decreases. Certainly it seems to slow down or retard the onset, or at least the rapidity with which you start spiraling downward once the diagnosis is made. Now, I personally have a family history of Alzheimer's, so I try to keep my mind busy, learn new things, mental puzzles, stay active as far as trying to stay on top of the news, try to exercise as much as I can, try to watch my diet. But I know that there's kind of like a sword of Damocles that's hanging over my future, in which I might develop Alzheimer's. Hopefully by then they'll have more treatments than Aricept and Abilify and antipsychotics to deal with the hallucinations. But until then, I guess we'll have to muddle along. And if you've got someone that has Alzheimer's, you know what I'm talking about. And for you, all these statistics, 61.9 and 91 point so and so, you know, they're kind of fade into obscurity, because for you, the person that's dealing with someone that has Alzheimer's, it's 100%. You know, it takes up a lot of your time, your effort. You know, it's really difficult. So I think that perhaps the only thing right now we can do is scream at our representatives and senators that maybe we don't need another supersonic plane. Maybe we don't, that cost $100 billion. We don't need, or $100 billion. We don't need another nuclear warhead. Perhaps we can slack back on going after all the people with marijuana, because ultimately, what's going to affect this country much more than a few people smoking weed is folks with Alzheimer's that can't work anymore, that can't take care of themselves, who require 24/7 attention, require expensive medications, and who, because of the stress on their non-paid caregivers, have additional health care costs that is going to spiral upward more than $9.1 billion now to who knows how much in 2050 year dollars with inflation. So right now, let's put some pressure on our legislators and say, look, one of our priorities is finding a cure for Alzheimer's. And if you've got a loved one that has Alzheimer's, or if you're heading into Alzheimer's, then I'm preaching to the choir. Thanks for watching this video. If you subscribe to my channel, I sincerely appreciate it, and I hope you have a wonderful day. Bye-bye.